Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. We shall be talking on autism cause controversy updates. We need to be updated on this finding of the cause of autism that even the U.S. Health Secretary Robert Kennedy promised that by September of this year he would have proven it. It made his effort, but the controversy are still there. It is now established, more or less, that there are so many risk factors and that autism itself is not one problem. It is a kind of spectrum disorder. That's why it is called autism spectrum disorder. But what is instructive is that the risk factors are proven, but they cannot be ascribed as the causa. That is, the causal relationship is not there. For example, when you talk about people, men who are really father children at after 50 years of age, you find that commonly there are some of them producing, children from them that are autistic. Then there are other things that Kennedy himself factored in, which was the circumcision of children. When this circumcision is done, they are usually given these pain relievers, the Tylenol or you call paracetamol, Panadol, or acetaminophen, which has been found more or less to correlate with the autism children. But the causal relationship has not been established. And that is why they keep saying that that is not acceptable. But when you now see it as a risk factor, that if you circumcise your child and you do not give all those medication that is ascribed, or some researches have found that it could be causing autism, then it is useful or advisable for one to abstain from it. And these are many of these I shall expose so that we can know what is really on as regards the risk factor and the research, and where the medical laboratory scientists could be involved. Because if we are able, there are so many variables that have been discovered that affect the neurons development of children below at the early stage, even in fetus. So you can now see if the medical laboratory scientists could find a test that with all these findings, that majority of the values of these substances are lower in autistic children when they are in the womb, and you now confirm that yes, this could be the cause. So the test will be done very early in, even at the early stage in the womb, to know what to do, where you need to increase the quantity or as a supplement from outside to the baby in the womb. There is also gestational diabetes mothers who have been found also to produce autistic children. So many of these findings and research I shall expose you to as we go into the side section. But as usual, click the like button, subscribe, and more knowledge will come your way to make us acquire more and more. The outline: objective introduction, risk factors, research findings, laboratory diagnosis, and finally conclusion are all that I shall be talking on. The objective: to update viewers on the area of conflict or controversy, the risk factors, and where the medical laboratory scientists can exploit for early diagnosis and treatment of autism spectrum disorder. The introduction: autism spectrum disorder has been controversial for a long time, and Robert Kennedy Jr. has been one of the influential advocates of anti-vaccines that pin the cost on the content of vaccine that these autistic children received. Daniel Oppenden, President and CEO of the Southwest Autism Research and Resource Center, showed the stable growth in autism diagnosis in recent years, 1 in 44 in 2018, 1 in 36 in 2020, and 1 in 31 in 2022. It shows a rise and a little fall in 2022. And Kennedy, as the health secretary, used this opportunity and promised to unravel the cause of the epidemic of autistic children by September of this year, 2025, which made the controversies international and trendy. And the report has been criticized by many researchers, which has made it more controversial internationally, as updated in this video. The risk factors. The older the parents, especially the father, the more likely the risk of autism. When you have fathers that are over 50, because the older father tend to accumulate more de novo mutation in sperm. So these mutated sperms are usually prone to give for 40 offsprings. Familiar, it runs in the family, is genetic. Child sex, more boys 4 times likely to be diagnosed with ASD. Early births, preterms or premature babies usually come down with ASD. This drug, Vaporate. Studies have also linked autism to maternal use of Vaporate, which is used for seizure. Gestation diabetes has 56% higher risk of autism. Now to research findings. We must understand that the diagnosis is clinical of ASD is usually performed with the help of a person's social and cognitive ability. In most cases, ASD can be diagnosed by the age of 2, but some patients are not diagnosed until they are adolescents or adult and showing the ADHD effect as their symptoms appear later in their lives. 2. Elevated blood level of serotonin or hyperserotonemia have been identified as potential biomarker of ASD and are present in more than 25% of affected children than normal. That's a research work level. Oxytocin 3 is a potential biomarker of ASD, and various studies have shown that the oxytocin level in plasma, saliva, and serum are lower than those in normal individuals. So, to diagnose that the patient is ASD positive or is an autistic child, the oxytocin would also help in that direction. More research finding. 4. Immunological biomarkers. Elevated level of tumor necrosis factor, alpha, have been found in children under the age of 5 with ASD. So mother immunoglobulin, such as hemoglobin G, which can cross the placenta membrane and target fetal brain tissue, destroying fetal brain development. These are autoimmunity, and is part of what if is found, you can use to confirm or diagnose that that child will be autistic. This type of reactivity to specific antigen combination was found in 23% of mothers of ASD children and 1% of the control. 5. The prevalence of mitochondrial disease, MD, is higher in ASD children than in non-ASD children. ASD biomarker can be detected with the help of various techniques such as immunological studies, electroencephalography, and epigenetics analysis. Laboratory diagnosis. From the research findings that we've seen so far, ASD biomarkers could be useful in laboratory diagnosis of ASD, children that have this ASD, autism. And it could be also useful for counseling people who are carriers, more or less, of mutated genes that may want to get married together and could result in autistic babies. Also, immunological biomarkers like The IgG for autoimmunity cases is very useful. Electroencephalography and epigenetic biomarkers are already in the making. The gestational diabetes could be confirmed. Finally, by way of conclusion, the knowledge of ASD is broad, and more findings from researches are ongoing. But it pays anybody to avoid the risk factors before planning to have children and even acquire knowledge on what to do in order to keep the impact down. One thing that has not been confirmed is vaccine implication in ASD for now, though some drastic measures have been taken in some states that vaccine is not compulsory anymore for every child. Like I've always been saying, if you like my presentation, please click the like button, subscribe, and more of this video, watch more on this channel. Bye.